Welcome to In the Shadows, where we shed light on difficult issues in our community. I'm Patty Lemons. I'm really excited about today's guest. Dr. Mike Ferguson is a psychologist, suicidologist, and mental health coach. And he's worked within crisis intervention for a big part of his career and is probably one of the most knowledgeable people on the topic of suicide in our community. Thank you for joining me, Dr. Ferguson.
I'm honored to be here, Patty, and honored to talk about this amazing topic today.
You know, I've heard from so many people that it's really hard to find mental health care, not only in Springfield, but everywhere. And people just don't know where to start. Do they need a psychologist or a counselor? Is there a difference between the two? Do they need a psychiatrist, or should they go to an emergency room? Can you just help us understand all the differences in the levels of care?
That is an excellent question, because a lot of people do not even know where to begin to seek mental health care and mental health treatment. One of the things that I do immediately when I begin to talk to somebody who might be facing a emotional crisis or thinking that there might be something that's going on within their mental health is to talk to their primary care physician. It is much more less intimidating to talk with your primary care than to immediately come out and tell somebody they should go see a psychiatrist. And there are different roles that we all play in mental health. We have in Springfield, we have licensed professional counselors, which are master level counselors and can help and treat and provide counseling. A psychologist is someone who has a doctorate in psychology, and so they have gone to the same amount of school years as has a psychiatrist, but a psychologist can do therapy and counseling and can also do assessments. However, they're not able to prescribe medication, and that's where the psychiatrist comes in. So the psychiatrists in our society and culture today are the ones who provide the psychotropic medications that are needed to help stabilize someone if they are in a emotional health or a mental health crisis.
So with all of those choices, I go to my primary care doctor and they say, you know, I'm not really comfortable handling this. You might want to go to a specialist. Who do I talk to?
Well, after you've seen your primary care doctor, they are, in fact, we're finding today in the mental health field, in the mental health world, that the primary cares are being much more attuned to mental health issues. And there is a lot of work being done by the American Psychological Association to inform our primary cares about treatment and about ways in which they can connect people with counselors to not only handle and deal with the life situation that may have brought on the emotional crisis, but also they have ways in which they can refer. So after you've seen your primary care doctor and you may not feel like that there's a referral that has come from that, I would encourage you to ask potentially friends, family members, others who might be in the mental health community. Because one of the most important things I think that is vital for anyone who's seeking mental health help is to find someone who in our field we call therapeutic alliance. There's a good fit with that therapist, there's a good fit with that counselor or psychologist, and they feel like they can share with them. And so the best thing to do in Springfield, because of the schools and universities that we have, there are a host of people in which to reach out to for different kinds of issues related to mental health.
I think one of my main goals with this podcast is just breaking down those barriers. Is there a place that we can go online to look at different options? Or do I need to go to a counselor for a couple of sessions and then somebody else if that's not the best match? Do you have any tips for breaking that down for people?
I do have tips for breaking that down and when somebody needs to begin to seek help. And some of the criteria for us is in developing counsel on when someone should seek help has to do with if what they're facing emotionally begins to interrupt their normal everyday activities, if they are finding that their relationships that were meaningful are beginning not to be so meaningful to them, And they find themselves not being able to go to work or participate in college or school. And if those things become interrupted, or those things become a challenge to do every day, then that's when I say it's probably time to ask somebody about what's going on and getting someone to help you understand what's brought that on. I'm a person who believes strongly that behavior always happens in a context, meaning that if you're facing anxiety, you're facing depression, you're facing some kind of mental health crisis, it's because there's been a context, there's been a situation, there's been some kind of problem, some kind of life event that's taken place. And as a result of that, it hasn't been processed. And, I'm a firm believer and strongly believe and have a guiding value that a lot of life provides us a lot of emotional crisis. And what happens is we fail to process those moments. And then they kind of accumulate and they kind of build up. And before you know it, we're very much like a 2-liter bottle of soda that just gets shaken up. And when you open the lid, everything happens. And so I really believe strongly in the idea that if we process life events as they happen, that there won't be this accumulation, and we'll have less mental illnesses, we'll have greater mental health if we can process those life events.
That's some really good advice. When we talk about mental illness, is it a chemical imbalance in the brain, or is it personal experiences? Can you just explain what it is?
Well, so explaining what mental illness is, because the science of understanding the brain has grown so much, and our ability as people who research in the field of psychology are able now to understand what parts of the brain light up when it comes to emotions, when it comes to experiences. We're now able to map the brain much better to know that there's parts of our brain that light up when we are sad, or light up when we are happy, or if we have a certain experience, if there's something going on. And so there is what I call a biological basis to behavior. So for instance, someone who has not had a history of depression, say in their family or in their life, how do they end up having a bout of depression, a major episode of depression? Well, what happens is our body is made to have this fight, flight, or freeze syndrome. And when we get into an anxious moment, a crisis moment, and we walk through stressful days for a long time, our body creates chemicals, adrenals and cortisol, that helps prepare our body to fight or flee, or in some ways, freeze. And if those chemicals are released constantly because of the stress of our lives, because of the crisis of our lives, what ends up happening is our body never gets a chance to relax and never gets back to a homeostasis where it is just simply back to a sense of non-stressful situation. And so what happens is our chemicals in our brain and the chemicals in our different parts of our organs get reset. And as a result of that, oftentimes someone needs medication in order to help stabilize them. And then we can begin to do talk therapy to be able to help them know how they came to being so in crisis state, and help them work through how they're able to not have that problem again.
So what about people, this seems to run in their family. Are there people who are more prone to mental illness?
I would say there's little research today, and I'm a strong believer that research informs practice. And so being someone who reads research and looks to research to help direct the work that I do, we only have a couple of mental illnesses that are chronic and that are lifetime and are genetic. However, the rest of those who might be facing a mental health crisis happens because life oftentimes interrupts some trauma, some tragedy. I know we are being trained as psychologists now today to be what we call trauma informed, meaning that rarely will you find anybody that you're working with or being a friend with who hasn't gone through some kind of traumatic event. And that traumatic event is something that makes a imprint on us. And again, if we don't process it and we don't learn how to cope with it, then it becomes a mental illness. But part of what I say, Patty, is that, and I like to take this approach for many reasons, but one is I like to say to those I'm working with, it's not that you're broken, but it's that you're stuck. And so if I can help them as a psychologist and a suicidologist, a mental health skills coach, to get unstuck, oftentimes that mental health crisis or that mental illness will dissipate and they can return to life and have a good mental health.
So for somebody to experience mental illness, are you saying all people experience a traumatic event, or are there people who are naturally born with that predisposition?
To say that people have a natural mental illness, or if they have a propensity or some kind of predisposition to a mental illness, is not quite so clear for us in the field. I know for me that I have encountered in the course of my work over the years that there are people who have and are what I call highly sensitive personalities. So I do believe all of us have a certain personality type, and I'm a strong believer in understanding how we've been designed. And there's some people who have a personality type that may be a little more sensitive to sort of the outer world and the things that happen just each and every day. So in those cases, a highly sensitive personality might take something that would be said or done in a way that another person would not take it so deeply and seriously, but they themselves do. So in that case, it's not so much that they have a mental illness or they come into the world with a mental illness, but that they are a little more sensitive based on their personality type. And as a result of that, it begins to be left unprocessed and not talked about and not sure how they're going to cope with it. So that begins to evolve into a mental illness.
What types of mental illnesses are the most common?
You know, what you used to say in the most common mental illness was for us in psychology, we used to say that depression was the common cold of the mental illness field. But one thing we found recently in research is that anxiety has outpaced depression now as the major mental illness that now is facing our society and our culture.
Do you find that there are a lot of people out there who do a lot of research online and they do some self-diagnosing, but then they don't follow up to seek care?
There are a lot of people, given the World Wide Web and the access to information today, that will look for symptoms and signs of what they feel emotionally or mentally, and will come up with a self-diagnosis. In fact, the work that I do with a lot of teens and young adults in the teen text crisis line, they will go ahead and pronounce to us or tell us, you know, I'm dealing with bipolar, or I'm dealing with depression, or I'm dealing with anxiety. And I would say 80% of those folks are people that we have to ask, is that an official diagnosis? And a lot of them say it's not. I've not seen anybody. But because of the internet and because of the information available to us, a lot of people are self-diagnosing today.
Do you encourage people to go online and research?
I do encourage people to go online and research, but to do it with a sense that everybody's situation is very individualized. Now, as a psychologist, we have a basic criteria for every mental illness, and there's over 250 mental illnesses listed in our diagnostic criteria manual. And you can find them all online. And I would not discourage somebody from going and doing some self-diagnosis. However, I would not encourage them to stop at that process, to see a professional, talk to somebody who's in the field to confirm or affirm whether or not that is what they're facing. I think also at the same time, on the flip side, the internet can also be a way that enforces a lot of myths about mental health. And sadly, a lot of people that I've encountered over the course of my years is that they walk in with a lot of myths about mental health, and it's because of what they've seen in the media or what somebody has heard or what they've read online.
The statistics say 1 in 5 people struggle with mental illness. Do you think that's accurate? Or do you think most of us struggle to some degree? And how do we know when we should seek help?
I would say that 1 in 5 people in America are facing a diagnosable mental illness. In fact, there was a research that came out recently that said now 1 in 4. So about 25% of our population are dealing with a diagnosable mental illness. But I do have to say, Patty, that there are a lot of people that have just gone through a lot of issues in their lives. They faced a lot of problems. I mean, life just is not an easy thing to have to deal with at times. And given the stress of our jobs and families and all the financial demands that we have on us, I think everyone is facing some kind of an emotional crisis. It may not be a diagnosable mental illness, but I have to believe that every one of us are facing some kind of emotional challenges that we have because of life, but it may not be something we can diagnose.
So when we're faced with those stressful situations, and we've talked to our friends, and we've talked to our family, and they've given us all the advice that they can, and their hands are tied, who do we turn to next?
That is probably that's a great question, and I think involves a couple of answers. So I'll give you my kind of thought about it, and that is, I would have to say that a lot of our friends and family obviously care for us, love us, and they're the ones we turn to first when we are encountering something that is emotional or it's beginning to interrupt our life. However, I can't say that every family and every friend are good listeners about that. An example is maybe we grew up and grow up in a situation or around friends and family when we start to cry because of an emotional situation or because the stress has gotten so much. Their approach might be, just stop crying, don't cry. And it's because they feel uncomfortable about someone sharing their emotional experience. And so, to me, unless that family can give a lot of good emotional support, it will get tiring for them to know what to do and how to help somebody. And so it's at that moment that it's good to be able to turn to somebody that has good listening skills, the ability to listen non-judgmentally, the ability to just sort of be with that person in their space that they're in and say to them, it is okay to be not okay. And if that isn't provided within the family support, I think it's vital that you do talk to someone about, do I need help outside of my family and the support system that I have? I know that research has told us that if families come around and support someone who's facing an emotional crisis or a mental illness in their family and support them in every way possible, their recovery time will be much faster. However, for those who don't get that support, their recovery time takes a lot longer because they're being made fun of, or they're being pushed away, or they're not being understood, and it makes it a lot harder. So having family support is vital. Whether or not the family can really be the kind of person or people that they need is also going to be a challenge sometimes.
It says in your title that you're a suicidologist. What is a suicidologist?
What is a suicidologist? That's a wonderful question. I get asked that all the time. And one of the ways that I answer that is to say that anytime you put ology behind a word, so if you put ology and you say psychology, that's the study of. So ology is the study of anything that follows the word. So psychology, theology is the study of God and religion. So suicidology is a study of suicide deaths, suicide attempts, suicide prevention, intervention, best practices for after a suicide has been completed. It takes into effect how and why and all of the impact that suicide has not only on the family, but also on the larger community. So it really is the study of suicide.
So I understand that suicide is on the rise. Why do people take their own lives?
Suicide is on the rise, sadly. And we're finding, at least in suicidology, that since I've been in the field, we used to have about 28,000, 32,000 people a year who would die by suicide. This last year, we had a little over 47,000 people who completed suicide. So we have a lot of work ahead of us in regards to prevention, intervention, and it's suicide is a very complicated issue. There are some researchers who would say that 90% of every person who dies by suicide has a mental illness. I am not so much on that side of the equation, but there are really three, probably the most predominant theory about why people die by suicide involves this idea of thwarted belongingness. So they don't seem like they fit in anymore, and they don't seem like they connect with people. Then there is this idea of perceived burdensomeness. And I hear that a lot from a lot of people, young adults and adults, who perceive that my family, my friends, that I'm a burden to them because I am having such a hard time just managing life. And so they almost feel very compelled to take their own life, so they are no longer a burden. So they almost feel like it's a help for their family. And then the final thing that becomes part of that mix is when people are habituated to methods of suicide. And what that basically means, interesting, a study came out many years ago. For us in America, the number one site for suicide is the Golden Gate Bridge. And so what they discovered as they studied people who would come to the bridge to complete suicide is that before they actually attempted or they jumped, they actually drove out to the bridge 5 or 6 times, and they would walk out to the place where they were going to jump, and they would stand there for a while. And what it does is it habituates them, gets them used to the potential death that they're about ready to take their own life with. And so as people become habituated with types of deaths, suicide deaths, that's when we understand there's a greater risk for people. So it's complicated. There can be emotional problems, family problems. The one thing we do know, Patty, is that when someone dies by suicide, they don't die to be selfish. They don't die to be a coward. They don't die in revenge. They die because of what we term in suicidology just so much psych ache. They are just consumed with so much psych ache that there comes a moment where death is the only way to solve the problem. And so suicide in every case is always an option to solve a problem. And so what we have found in the prevention and intervention of suicide is that if we can help someone think through other problem-solving ways, that we can potentially deflate that suicide ideation and desire.
This is all really great information, and I'm going to go ahead and wrap today's episode and continue this conversation in the next one because there's just so much good content, and I want the information to be digestible for our listeners. And that episode will be released later this week, but here's a preview.
Our particular approach in suicidology and in our training is that we need to take every suicide ideation, discussion, talk seriously. And I have a lot of families who will text me, or they will message me or call and say, I just think, my 14-year-old daughter, she mentions suicide all the time, and I just think she needs attention. or is wanting attention. So I always ask the parents, I said, well, if she needs attention, go ahead and give it to her.
Thank you so much for joining us for this episode of In the Shadows. We're currently looking for sponsors to keep this project going. Please visit intheshadowspod.com for more information and to subscribe to this podcast series. You can also subscribe on iTunes, Google Play, or YouTube. Help us educate and change the statistics in our community by sharing this podcast on social media. If you need immediate help, please call the National Suicide Prevention Hotline at 1-800-273-8255 or text the crisis helpline at 741-741. In Springfield, Missouri, you can text today's guest, Dr. Mike Ferguson. He's a psychologist, suicidologist, and mental health coach at 417-501-9622. And on our final note, as we say every time, please remember to be kind to everyone. We don't know what challenges others are facing on any given day, and a smile from you could turn their world around.